Knowing your family health history can help you make the correct medical decisions for you and your family. And Ancestry Health is designed to help people understand the risk for certain health conditions. We've got Dr. Sarah South joining us now. Thank you so much for being with us.
Thank you for having me today.
So Dr. South, I want to just ask you right off the bat, what exactly is Ancestry Health and how is it different from other consumer genetic testing options on the market right now?
As you mentioned, it's a way to understand more about your genetic risks for certain actionable and preventable health conditions, such as breast cancer, colon cancer, or cardiovascular risk. We look at your DNA using an advanced sequencing technology called next-generation sequencing, which gives a more comprehensive review of your DNA for these risk factors, so that if they're present, we're more likely to identify them. This information is then delivered to you through an online portal, which provides a large amount of information so that you can understand what was found and what are your next steps. There's also information in there specific for your physician so that when you share it with them, they'll know what was found and what are the next steps. There's access to genetic counseling service should you have additional questions. And we're encouraging you to share this with your family members so that they can recognize, since they share DNA with you, if they may also have these additional risks to their health and can take preventative actions.
And how does next generation sequencing work?
Unlike the more traditional technologies of microarray, which just looked at snapshots, next generation sequencing looks at the entire genetic sequence for a particular gene that may be associated with the health risks. And then, therefore, if a genetic risk is in your DNA, next generation sequencing is more likely to identify the risk.
And as a mom yourself, how do you think Ancestry Health is empowering moms and families overall?
It's important as a mom to keep yourself healthy so that you're around to be able to help your kids. By knowing these risks ahead of time before conditions develop, you can take actions to prevent those conditions. And then since you share DNA with your family members, then you can share that information with those family members so they can talk to their physician about if genetic testing is appropriate for them.
I'm also wondering how Ancestry is working better to understand the possible role of genetics in COVID-19.
As a separate project, Ancestry has reached out to its customers to ask if they want to participate in studies designed to look at both genetic and non-genetic factors that are related to the susceptibility to COVID, as well as the severity. So individuals who volunteer to participate in this study answer questions, as well as have the answers to those questions match their DNA profiles to learn more about the genetic and non-genetic factors. This data is then shared in a de-identified way with the international consortium so that we can come to solutions faster together.
And Doctor, where can our viewers go for more information?
You go to ancestry.com/health to learn more about this and to also learn more about the COVID research studies.
Dr. Sarah South, thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.